Ich habe jetzt die ganz große
It is
Ehre,
my
die
great
nächste
honor to announce the next
Sprecherin
speaker of
des heutigen
today.
Kongresstages anzusagen. Bei TimeWaver sind wir schon
We
viele
have
Jahre eigentlich
worked
mit
with
Frau
Dr. McMakin for
Dr.
many years
McMakin verbunden, dadurch,
at the
dass wir ihre
TimeWaver
Arbeit verfolgt haben, die
Academy.
sie
We've followed
über
her
viele
work for
Jahrzehnte in
a
den
while.
USA
She has
macht, als
been
Praktizierende
practicing
der Heilkunst,
for
aber auch als
many
Forscherin
years,
und als
decades, also in
Ausbilderin.
research
Ich
and as
möchte
a
Frau
trainer.
Dr.
So
McMakin mit
please
einem
welcome
Applaus
Ms.
gerne auf
McMakin
die
with
Bühne
a
ein.
round of applause.
So I'm so happy that you're finally here with us. I will continue in German.
Yeah.
Oder English? English is okay? Okay. I'm so happy because I got in contact with your work through one of our Norwegian therapists, Jan Fredrik Policzynski, who's unfortunately not here this time. And he sent me your English book. And I got to learn about your work, how to use two frequencies simultaneously. And I immediately thought, oh, this is something which we actually would like to include in our system. This is maybe 7 years ago, or 6 years ago. And it was a long way of many coincidences which brought us together here. And it's so well, it fits so well that you are here, and simultaneously the device which can do your therapy is actually ready. It's a TimeWaver frequency dual wave, so it's not just some theory, it's something which all of you who have a TimeWaver frequency in future will be able to practice. And it's amazingly effective, and what inspires me is that there's a very good background of research and studies. 3 years ago, I had a meeting with the chief medical doctor of Red Bull. You know Red Bull? It's something I drink 10 times a day to keep awake.
Of course you do.
Of course. And so I had this meeting, and we prepared with many studies about effectiveness of frequencies. I think we gave him around 130 different studies, which are a basis of our clinical evaluation. And he picked 2 of them, which are interesting, and these were both from your work.
Oh my goodness.
Yeah, all the other stuff he said he's not interested in. So there's I forgot which one it was, but
Cytokines.
yeah, absolutely amazing. So I'm really happy you're here and speaking today and tomorrow.
Yes, yeah.
All right.
It's an honor to be here with a group that is already has a foundation in the understanding of the effects of frequencies and resonance, and to be with a group that is so like-minded and compatible. It's a pleasure.
Yeah, and I think all of us from our team have this feeling that we feel, so it's such a nice personal relationship also. Yes.
Easy fit.
And I remember the first time I met you was maybe 2014, that in this Marriott Hotel. I think you had some lecture there, and I had a lecture in another hotel in Frankfurt. So I was somehow in my thoughts preparing, for my lecture, and I had a book under my arm. And this was a book related to my lecture from John Cunningham Lilly. And I thought, okay, he was a researcher doing research on dolphins, and communication with dolphins, and some other stuff about LSD, but like official research. And I was fascinated by his work. And so then I entered into the hotel to meet you in the lobby there with Babak and Shamnam. And I had one question in my mind. Oh, she's coming from US. Will she know this Dr. Lilly? This was the question. And because I was in my thought, I bumped into some display. And I had to make a step back, and it was a big red display, and there was written Lilly. I thought, what's this? Is this my thoughts manifesting? And then I looked, and it was a conference on diabetes of the American
drug company,
which was founded by the father of John Lilly.
Oh, that's bizarre.
Yeah, it's bizarre.
Yeah.
This is the reason why he studied science and medicine, but later he did his research into the different realms of consciousness, using all kind of methods. He invented the samadhi tank and different kind of things, worked on a very high level. So I see in this synchronicity the shift from what his father did, drug company, to what he did is like research and healing with consciousness, and frequencies are the link between these two
Synergy
ways.
is a good word.
Synergy.
Synergy.
All right, the stage is yours.
Thank you very much.
Thank you.
Thank you. So since you are already using frequencies, they asked that I talk about how the frequencies work. You know that they work from clinical experience, from personal experience, from what you do with yourselves and your patients, from your methodology. The research we have done, the clinical work we have done with frequency-specific, make some suggestions about how the frequencies actually work. So you already use frequency with TimeWaver. How do the frequencies work? What exactly are they doing? We can use phrases like resonance and like information field, but bring it back down to how it actually works. The data gives us some idea about how they work, because how they work will affect what frequencies you use within the frequency-specific microcurrent system, and why and how you use them. So our system is a little bit different. I got a list of frequencies from an osteopath who bought a practice, a medical practice, in 1946 that came with a machine that was made in 1922, and that machine came with a list of frequencies. So he used them in his practice, plus osteopathic adjusting, plus nutrition, plus acupuncture, and he became quite famous in Canada and the Western US for fixing people that no one else could fix. He was extraordinary. So we resurrected the list. My colleague got the list from Dr. Van Gelder in 1983 and put it in a drawer. 1994, I started chiropractic practice, the age of 47, and he found the list. At the same time, there was a machine that would do 2 channels the way Dr. Van Gelder's old machine did. The list had frequencies for conditions like inflammation and scarring and toxicity, and frequencies for tissues. So with experimentation, we found out that on that machine it worked best to have frequencies for conditions on channel A, frequencies for conditions on channel B. So to neutralize inflammation, you put that 40 hertz on channel A. To neutralize inflammation in the nerve, you put 396 hertz on channel B. It's fairly straightforward. I started teaching them in 1997 to find out if they were reproducible. Does it work because I'm nice and I have nice hands and the walls in the clinic are pink? Yeah? Or is it real? Is it reproducible? Can a student do it? Can a chiropractor do it? Can an acupuncturist? Is it reproducible? That is science, yeah? You make an observation, you do this, that happens. You do this and that happens again. You do this and that happens again. Pretty soon you can predict that if I do this, that will happen. Then you know it's reproducible. That was important to me. I will say honestly, I have no idea how the frequencies were derived. In 1934, the American Medical Association said that anyone who used frequencies or nutrition or herbs or electromagnetic therapies would lose their license to practice, which at that time was granted by the AMA. So the machines went in the back room, got covered up with a sheet, if they were lucky. Most of them went in the trash when grandfather died, When father died, the machines went away, and worse, all of the research, how they developed the frequencies, all of their personal documents, all of that disappeared. It is maybe in rare book rooms, it is maybe in somebody's attic, nobody knows. So I have no idea how the frequencies were derived. Essentially, I don't care. I'm a clinician. I like to fix things. It's broken, I want to fix it. It either works or it doesn't. When it works, I do it again. When it doesn't work, I think about it, I do something different. So that's the background. We know that the 1920s equipment was not microcurrent. So let's go through some of the data that we have and some of the theories we have about frequency specific. So we have a frequency to neutralize inflammation, yeah? Inflammation causes all degenerative diseases, all of them, have at their foundation inflammation. Have you thought about what causes inflammation? What causes the inflammation? Infection and injury are a threat to your life, and they activate the immune system and create in the immune system inflammation by changing cell signaling. There are genes, someplace here, is there a, I don't want to turn this off. Is there a laser? Yes. So they activate infection and injury, sends signals that activate this receptor on an immune system cell. There are regulatory mechanisms from the vagus nerve that affect the activation of this cell, create cytokines. Now, the infection is killed, the injury is healed, and you return to health. But sometimes this system does not resolve. So the non-resolving inflammation gives you rheumatoid arthritis, atherosclerosis, inflammatory bowel disease, other chronic inflammatory conditions, and sometimes it just leaves the patient sick, right? Loss of function, tissue injury, pain, ongoing. But it should resolve. You're designed for this. So the key here is this, the signaling in the immune system. Changes in cell signaling change genetic expression. The piece of bacteria, the announcement of the injury by the injured cell activates the immune system. What does that mean? It changes the genes that are on. You have genes, some of them are on, some of them are off. They have switches, they go on, they go off. Depending on what you need, depending on the signaling that comes in from the outside. They change genetic expression and turn on the genes that create inflammation. So, a piece of a bacteria, a signal from an injured tissue, strikes on this, lands on this receptor. That receptor activates kinases. That activates transcription factors. These are all connected by fibers inside the cell. It's like a microchip. There's a matrix inside the cell. It's not empty. These signals come down both chemically and electrically, change the kinases, change transcription factors that change what the cell does in the environment. This is the definition of epigenetics. When the cell genetic expression changes in response to the environment. So the real question is, well, number one, the real question is, do you want to turn inflammation off? Not when it's needed, but you want to turn inflammation off when the cell forgets how to do it itself. When something interferes with the self-corrective mechanism the self-regulatory mechanism of the cell. How do you correct that respectfully and appropriately? So, frequency specific, this frequency tool that we have, ended up reducing lipoxygenase-mediated inflammation by 62% in 4 minutes in every animal tested, and cyclooxygenase-mediated inflammation by 30% in 4 minutes in every animal tested, and it normalized immune system function. The 30% doesn't sound as impressive, but it is equivalent to the injectable drug Toradol that they used postoperatively when it was tested by the same researcher in the same animal model. So we have 2 frequencies, one for a condition and one for a tissue. So this, it's up off the top of them. So this is blinded animal research. It didn't start out that way. They did the first 10 mice. They would paint arachidonic acid on the mouse's ears, and that's what the swelling should look like measured in micrometers. Then they treated the mouse with 40 hertz on channel A and 116 hertz on channel B is the frequency for the immune system. So to reduce inflammation in immune system cells, they treated the mouse. They had graphite gloves, and they grabbed the mouse by the neck and the tail and treated the whole mouse. And then the swelling in his ears was measured. Well, originally in the first 10, they had 70% reduction in inflammation. And the researchers shut down the lab because in 25 years of doing this research, she'd never seen a prescription drug or any intervention reduce inflammation by more than 45%. And when it came out 70%, she decided somebody must be cheating. So the next day, she had everybody back, and she put them all in separate rooms and closed the door. And she went in and put in a placebo frequency so the person treating the mouse would not know and would not be able to influence the outcome. And with all those precautions, it was still 62% reduction in lipoxygenase and 30% reduction in cyclooxygenase. So lipoxygenase-mediated inflammation is what causes or is the problem in irritable bowel, Crohn's disease, asthma, COPD, emphysema. So neurodegenerative diseases are both lipoxygenase and cyclooxygenase. So to be able to turn off the cell signaling that creates that inflammation was good news, was important for patients. And what they found was that only one frequency combination reduced inflammation. So they tried 1/10 of a hertz, and it made no change. They tried our frequencies to reduce mineral deposits in bone. There's no bone in the mouse's ears, there are no minerals. So the current alone doesn't do it, and another frequency combination besides this doesn't do it. And we also use the frequencies for what we call the new injury protocol, which does not include 40 hertz. So we tried 2 other sets of our frequencies plus just the current. And there was no change. It was equivalent to placebo. Only 40 and 116 did what it did. Now, there is a precaution. With power comes great responsibility and thoughtfulness. So, your body uses inflammation to contain infection. Yes? It has a purpose. When you have an infection in your tooth or in your bone or someplace, there's pain. There's pain because there's inflammation. There's inflammation because that bacteria fragment will land on the immune system and cause the immune system to create inflammation. And you have the inflammation, and it is acting to contain the infection. What we have found clinically is that the frequency will override the bacterial signaling and turn it off. the frequency will override the bacterial signaling and turn the inflammation off, even in the presence of infection. So when we use 40 and 116, or 40, which is the frequency to remove inflammation, and any tissue, if the pain goes up during the treatment or within 4 hours after the treatment, the patient has an infection. It's diagnostic, and practitioners are strongly advised to pay attention to that and to seek appropriate interventions for infection, okay? So the frequency turns off the inflammation for immediately, within 4 minutes, and it lasts about 4 to 6 hours. So at the end of 4 hours, after the inflammation has been gone for 4 hours, the infection comes back and it's worse because it has had 4 hours with no containment. Does that make sense? Do you see? So it's, if the patient has an infection you know about and they are on antibiotics, then it's okay to treat. Here was another aspect of inflammation, and that is that when you sunburn a mouse, his ears swell. So if you sunburn a mouse and you don't treat him, that's how much swelling there is at 21, how many hours? 21, 23, 25, and 27 hours. They treated one group immediately, and they had some reduction in swelling, but it wasn't statistically significant. They had another group they treated at 2 hours, and they had a statistical significance, 0.01, 0.05, reduction in swelling at 21, 23, 25, and 27 hours. Now, the thing that I didn't know before this research was that sunburn suppresses immune system response. So if you paint a contact sensitizing agent, an agent to which you should develop an allergy reaction on second exposure, you paint that sensitizing agent on the hind leg, and then you sunburn the mouse, and then 2 weeks later, you paint that sensitizing agent on the ear. So that is the experiment. Contact sensitizing agent, sunburn, re-exposure 2 weeks later, okay? In a sunburn mouse, the immune, this IS is immune suppression, was 63.4%. So the swelling in a non-treated mouse would be this much. The swelling in a sunburned mouse would be this much. So the immune system response to oxazolone was suppressed by 63%. The group at 2 hours that was treated with microcurrent, that had the best reduction in swelling, had their immune system suppression reduced from 63 to 57%, by 6%. That's nice. Oddly enough, the group that was treated immediately had their immune system suppression reduced by 31%, right? Or to 31%. So it was a 30% reduction in immune suppression. The numbers, the mechanism, a little bit difficult to grasp, but the important thing is that a single 4-minute treatment with one and only one frequency combination produced a permanent change in immune system function. Of all the data we have, to my mind, this is actually the most stunning. It took me 10 years to understand how important this was, because it's 2 weeks after the application. It's extraordinary. So, inflammation and cytokines are associated, inflammatory cytokines are associated with pain and degeneration in the brain and the joints. We have data that says that the frequencies reduce all of the inflammatory cytokines, but importantly, they stop in the normal range. When you treat cytokines with drugs, the problem that happens to the patient is that the cytokines drop below the normal range, and you need cytokines to protect you from infection and from cancer. You need inflammation to kill off those agents, infection and cancer. So patients who are on cytokine-reducing drugs get infections and cancer. With frequency-specific microcurrent, the cytokines stop in the normal range. They do not go too low. The only conclusion that you can draw is that the genes making the cytokines have been turned off. That's what we think the mechanism is. This was the study. We had 54 fibromyalgia patients with fibromyalgia from spine trauma. The average chronicity was 9.5 years. So if they were going to have a placebo response, you assume that they would have it from one of the 10 other people that had treated them in 10 years. We did blood sample data on a subset of 6 patients. I gave a lecture at National Institutes of Health to a Grand Rounds group and said, I've done this 25 times and no one is going to believe me unless I have something objective. And Terry Phillips came up and said to send him some blood samples. He sent me blotter paper. He's a microimmunochemist, and he sent me the data. This fibromyalgia from spine trauma, if you look at the pain diagram here, and you see pain patients, these are your most difficult patients. Their pain level is an average of a 7, someplace between a 5 and a 10 on a 0 to 10 scale. And this is their pain diagram, and in the US, it's 28% to 30% of fibromyalgia patients, so that's 2 million people in the US alone, whose pain is a 7.4 as an average, and it does not respond to opiates. So it's a 7.4 on morphine, on oxycodone, on opiates. So these patients recovered, 58% of them recovered. All of them got out of pain. They had FSM in the office, they had a home unit, some of them, they had physical therapy, reconditioning, exercises, supplements. Fibromyalgia is complicated. Getting rid of the pain is the first part. So when we got the blood sample data back on the first patient, this is what it looked like. Interleukin-1 went from 392 down to 21. When I called a colleague in Washington, D.C., and said, I don't know much about cytokines. This was in 2000. It was before Wikipedia. It was before you could Google it, yeah? So he said, yeah, what are the numbers? I have cytokine data. What do I do with it? And I told him that it went from 392 down to 21. And it was like the phone went dead. He said, that's impossible. In 90 minutes, cytokines are hard to change. And when they change slowly. That's impossible. Who did your data? I said, Terry Phillips. He's the same person that does your data. And he said, well, they're hard to change. I said, no, they're not. They all change like that. I said, what do you mean? TNF alpha went from 299 down to 20. They're going down by factors of 10 and 20 times in 90 minutes. Interleukin-6 went from 200 down to 15. Cytokines are created by changes in cell signaling. All of these cytokines were reduced at logarithmic rates by factors of 10 and 20 times. The only thing that could possibly explain that rate of change and the fact that they stop in the normal range, the only thing that could explain it is changes in cell signaling. This is a theory that we think we can now test. Substance P goes down, which means that the frequency 10 to address the spinal cord is actually addressing the spinal cord, because substance P is manufactured in the spinal cord and sent out into the blood where we measured it. Endorphins go up by a factor of 10, well, more than 10 times, from 5 to 88. Endorphins are what makes the runners feel good when they run. And in point of fact, it makes these patients stoned. Is there a word? Like, dude. By this measurement in here, They don't want to talk and they don't want to open their eyes. Cortisol goes up, but it's not a stress response, because if you're raising endorphins, you will also raise ACTH, and that will accidentally raise cortisol, but neuropeptide Y drops, so we knew it wasn't a stress response. Pain went from an average of 7.3 to a 1.3, and the statistics on this, for those of you that appreciate statistics, this p-value actually has 6 zeros. We publish 3 because that's all you publish. Anything more than that is just showing off. So 3 zeros. So 58% of the patients recovered from fibromyalgia. That is, they didn't have it anymore. Fibromyalgia is not incurable. It is not mental. It is not psychological. When the pain level is a 7, it is a complicated neuroendocrine condition that we can change. 13 out of 53 discontinued treatment after 1 to 3 visits for reasons not associated with treatment side effects. They all got out of pain. They all got stoned. The pain comes back, and then we could treat it again. So they all stayed long enough to find out that it was reproducible. The biggest challenge we had then, and actually the biggest one we have now when we treat this group of patients, is when you have been in pain for 12 years, and your pain has been a 7 for 12 years, and your pain goes to a 0 in 90 minutes, who are you? Right? Who are you? We create an existential crisis that is unparalleled in medicine. There is no other place where this happens. And so there is ongoing treatment and support. We now have frequencies that we use to help the patient through that transition. And it helps when you warn them. You have to recreate yourself now. Who are you now that you have a future that is not pain? So this is most likely, does this pain diagram look familiar to you? Yeah? Have you seen it before? This is your most difficult, for most people, perplexing full body pain patient, and she recovered in 8 weeks. She no longer had fibromyalgia, and at 6 years, she had still stayed recovered. So it is possible to cure this difficult condition when you can get the pain down and when you can increase energy production in cells and when you can help help the body regulate itself. So the genes that get turned on by injury determine the rate of healing. Think about that. When you get a cut, when you bruise yourself, when you bump your shin on the coffee table, it hurts, but there is a sequence of natural events that happens that you don't know about, you don't think about. It hurts, you rub it, goes away. What happens though? Genes get turned on that determine the rate of healing. There is a process that happens that's controlled by genetic signaling. And the frequencies change those genes and speed up the healing. The current has a role. Microcurrent increases, I can't see the top of the slide. Microcurrent increases ATP production by 500%, by 5 times, and provides virtually unlimited energy for healing. That's just the current. So the combination of microcurrent and the frequencies are incredibly powerful. So the first case that I ever treated was a woman that was a ballerina with the Portland Ballet Company, and she was hit at 30 miles an hour. I'm not sure how many kilometers that is, but 30 miles an hour, enough that her minivan tipped over. She crawled out the back, went to the hospital, had x-rays. She called me at 8:30 in the morning and was at the clinic by 11:30. The examination took 1 hour, and we treated her from 12:30 to 2:30. So she had 2 hours treatment Immediately, so within 4 hours of the time of the accident, she had 2 hours treatment. And the frequencies are things to stop bleeding and turn off inflammation and withdraw the trauma from the tissue. Yeah? At the end of the 2 hours, I told her that, at the beginning, pain level was a 6 or 7. She had pain in her face. Her range of motion was 20 degrees in all directions. At the end of an hour, pain was 0. And I said, this isn't going to last. Tomorrow your pain will be much worse than it was today. And the day after that, it's going to be worse. And it's going to take you 4 months to recover, because that's what I knew. That is standard for that kind of accident. The next day, she came in completely pain-free with full range of motion. And it was as if the sun went down in the east. It was, what? I'd never done it before. Because you don't usually see, in my business, you don't usually see patients immediately after. So I put it on the shelf and thought, well, that's interesting. And then we found out through experience that that time limit was about 6 to 8 hours. As long as they got in between 3 hours and 8 hours after the injury, you could really accelerate the healing. In the US, I did this with a football player in 2004. He was injured. He fractured his fibula. He tore the membrane that holds the fibula and the tibia together. He avulsed the ligaments that hold the ankle onto your leg. It was ugly. It was 18 to 24 weeks before he would be able to walk, much less run. And they called me Monday. He was injured on Sunday. They called me Monday morning and said he wants to play in the Super Bowl in 6 weeks. Can it be done? And it's like, gulp. Yes, we can do this. But I have to be there when he gets out of surgery because of the 4-hour window. So I flew that night to Philadelphia. He's on the other side of the country. Arrived. He gets out of the operating room, recovery room. They wheel him out to the limo. And in the car, I hooked the machine up and started treating him to stop the bleeding and turn off the inflammation. Treated him an hour drive to the house. And I treated him for 24 hours straight with no interruption, except when he went to the bathroom. When we slept, he slept laying down on the couch. I slept sitting up and woke up, changed the frequencies, went back to sleep, changed the frequencies, went back to sleep. Did that for 24 hours. When the team trainer came in the morning, he said, well, all right, let's see it. So we undid the boot. We cut open the bandage, and nobody could believe what they saw. In a surgery like that, the ankle should have been this big. It should have been the size of a football. Yeah? It should have been this big. It should have been black, in the color of my shirt. There was 0 swelling, zero swelling, 0 bruising. In 4 weeks, the fracture had healed. This open spiral fracture was healed. In 4 weeks, the ligaments were stable on x-ray, on fluoroscopy. And in 6 weeks, he played, well, 5.5 weeks, we took apart the scar tissue. So we healed him so fast, there was scar tissue, but the frequencies that dissolve scar tissue are the second precaution. You can't run those frequencies until the injury is 5.5 weeks old. So we treated, when he got to Florida for the Super Bowl, he couldn't run because of the scar tissue. Wednesday, 4 hours. We melted the scar tissue in his leg. This between the nerve and the fascia and the bone, there's a frequency for the periosteum. When you have scar tissue between the nerve and the fascia and the periosteum, the muscles won't work. So we took that apart for 4 hours. The next day we did 2 hours. And on Friday he ran like he'd never been hurt. And on Sunday he made touchdowns. They lost the game, but that was because their quarterback does not like getting knocked down. So not his fault. But he played like he'd never been hurt. So that is the 4-hour window. Then 5 years later, we found out what happened. In 2010 or 12, Diana Cross found this. There are early genes in injury that turn on immediately and within the first 4 hours and are off. They're off at 6 hours. That's why the window is 4 to 6 hours. Whatever we're doing to stop bleeding and reduce inflammation changes these genes. It keeps them from turning on. And because you increase energy production and because you reduce inflammation, you skip that whole first 2 or 3 week process because you change the genes. And you accelerate healing beyond anything that is comprehensible. Like this. This woman had a facelift, right? This is day 1. They treated her for 80 minutes, immediately post-operatively, and for 7 days, an hour and a half treatment. But look at her. Day 2, day 4, day 5, day 6, a little bit swelling on day 9 for some reason, but that's day 11. Have you ever seen a patient who's had a facelift 11 days after the surgery? Doesn't look like that, right? We have a blinded trial in delayed onset muscle soreness. There is no cure for delayed and no prevention for delayed onset muscle soreness for athletes. When you work out, you injure tissue. And there is a study by Allen done in 1999 that says that plain unmodulated microcurrent at 0.3 of a hertz for 10 minutes and 30 hertz for 10 minutes does nothing for delayed onset muscle soreness. So 20-minute treatment, 200 microamps. But these frequencies are 18 and 62 to prevent bruising and to repair torn tissue in the muscle belly, the fascia, the tendon, reduce inflammation. You saw that, you recognize that. 40 and 116, quiet down the immune system, reduce inflammation in the muscle belly, the fascia, and the tendon. Each of these frequencies means something to me. FSM is like a language. It's like learning a language in 4 days. And then support vitality. This was published in 2010, and this is the study. At 24 hours, the sham leg, so one leg was a sham, one leg was active. Sham leg had a pain of a 5, treated leg was a 1.3. 48 hours, it was a 1.2, it had actually dropped. And the pain in the sham leg was a 7, it had gone up. And at 72 hours, this was a 4, and it was less than 1. The thing about delayed onset muscle soreness is that there's no treatment, there's no prevention. So elite athletes, football players, hockey players, Olympic athletes use FSM with our trained sports practitioners to help them train and be stronger and repair from injury faster. So frequencies change genes and speed healing. How do they do that? How does it change a gene, right? So the human body, you're already ahead of me on this, right, is a quantum biological system. Living tissue is biochemicals. We're used to a chemical model for how the body works, right? Drugs and nutrients land in receptors and change the tissue. But what are biochemicals? What are they? Well, they're molecules. What are molecules made of? Well, they're made of atoms. What are the atoms made of? Subatomic particles. How are they held together? How does an atom, how do the subatomic particles form the atoms? How do the atoms form the molecules? How do the molecules form your arm? Yeah? They're all held together by electromagnetic bonds that we aren't close to understanding. And the important thing for our purposes is that every bond has a frequency at which it resonates. Every bond has a frequency at which it resonates. So your body is effectively an electromagnetic system that looks solid. But because of the way the water in your cells is organized and collected on the matrix inside the cells, they form a gel that creates a matrix that is very much like a semiconductor. When water molecules are held in the matrix and they flicker, there's a hole that forms a structure that's very much like a silicon chip that's in your computer, okay? So your system is a semiconductor network that conveys current, charge, and information. There are chemical reactions that happen in your liver 10 times the speed they could happen if they were simply a chemical reaction. There is an electromagnetic door, back door, into enzymes in your liver that allow rapid communication along the systems in your body. So in science, you have an observation. You see this, and then you see it again, and you see it again, and it becomes predictable. You have observed effects that you have to explain. The only explanation for what we see with the frequencies is resonance. This resonance with bonds. What is resonance? We say it all the time, but what is it? It is the tendency of a system or a bond to oscillate, to vibrate at large amplitudes in response to some frequencies, but not others. And at the resonant frequency, very small forces can produce very large amplitude vibrations. Have you all seen the trick where the singer will sing a note, which I can't sing, sings a note that causes a lead crystal glass to shatter? You've all seen that? Yeah. My chemistry teacher explained how that trick works. It only works with lead crystal because the frequency that holds lead atoms together in that crystal matrix, there is a frequency, one, that holds lead atoms together in the lead crystal matrix, and when the singer sings the note precisely enough to get the molecules, get the atoms vibrating, and she holds it at the right precise frequency long enough that the molecules vibrate more, they simply come apart. It's a human voice. It's not volume. It's resonance. Small input, big response. That's resonance. And that's how the frequencies work, we think. Biologic resonance explains the effects on living tissue. Drugs or nutrients, we're all used to that, yeah? You have a receptor on the cell. We saw that one. This same receptor that accepts signaling from the environment, from your emotions, from bacteria, from injury, from chemicals in your body. It accepts signaling. Well, drugs and nutrients land on that receptor and act like a key in a lock. Open it, close it, change it. That changes the way the cell operates inside. Biologic resonance explains the effects on living tissue. It's biologic resonance. The frequencies act like your key fob on your keychain that change this membrane protein, this receptor, electromagnetically. Same lock. Key, signal. Key, signal. The data we have says that the signal will affect the receptors as strongly or more strongly than the chemical. It acts as if the frequency changes cell signaling. It acts as if you dissolve scar tissue crosslinks, and we'll talk a little bit more about that tomorrow. But in shingles, there are frequencies that are one frequency combination, channel A, channel B, One frequency combination, the only thing it's good for is shingles and oral and genital herpes. Shingles in the outbreak, pain is gone in 20 minutes. You run it for 2 hours, and the shingles lesions are gone in 2 days. The pain never comes back, it's permanent. How did that happen? That is predictable, reproducible. We are now thousands of cases. There's no question on that frequency. The frequency appears to, the only thing that makes sense, is it disassembles the virus itself. That is the only thing that makes sense. The shingles virus is very simple. It's 723,000 Daltons. And there's only 6 fairly crucial bonds that hold that, it looks like a transistor, a little shell together. And when you hit the frequency that makes those bonds vibrate, it appears as if the virus just comes apart. We have to test that too, right? I've spent 20 years training clinicians, and they would rather have dental work than publish a paper. So we have very little that's published on this. The resonance effect is the book that I wrote this year. Well, I wrote it last year, but it's published this year, about how frequency specific was developed, and it tells the stories and actually gives the frequencies out for visceral conditions: asthma, irritable bowel, Crohn's disease, brain injuries, PTSD, all the things that we couldn't publish in a technical textbook. And it tells a good story about how FSM works and what's behind it. There's a textbook which, thanks to TimeWaver and Shyam, has been translated into German. And it's the first foreign translation of the textbook, and I am very grateful that you did it. Thank you very much. We have 2 classes. The slides change themselves. That's very annoying. So I have a 4-day class next weekend in Nuremberg from December 1st to the 4th in Nuremberg. I don't have the hotel information, but I think you do. And then we have scheduled a core seminar for London next September. So if you can't come next weekend, you can come. I have to warn you ahead that as much as TimeWaver and what you do with that has changed your life, once you start using the frequencies specifically and directly, frequency-specific microcurrent will change your life forever, but in a good way. Thank you very much. Yeah.